Well, it's good to have everybody join us on the show. Welcome to Conversations with Marianne. I am so glad to have you all be part of the conversation this Monday evening. As usual, we talk about stories emerging from the African continent, and we look at everything ranging from education to health to politics and even social stories. Well, today we are going to be visiting Senegal, talking about Senegal and its fight against COVID-19. For the past few weeks, we've been looking at major African countries and the experiences that they've been having so far. And today, my guest is from Senegal. He is a broadcast journalist with the West African Democracy Radio in Dakar, Senegal. He's going to help us walk us through the situation in Senegal, especially with the protests that erupted in the capital after several new rules for COVID-19 were enacted by the government. Once again, I'm Mariana Cone, and I'm broadcasting live from Lagos, Nigeria. My guest is Adolphus Mawolo. He is right here. Hello, Adolphus. It's good to have you join us. I hope I pronounced it right.
Good afternoon, Marianne. I'm really glad to appear on your program today. Thank you very much for the invitation to sit on your platform and speak to the people of Africa.
Great. I'll start by asking exactly what the situation is in Senegal right now. As we speak, 20,000 cases of COVID-19 have been recorded. The government has been saying that they need people to stay indoors. There's been a shutdown, and this actually led to a protest within the city. Walk us through that. What's the situation in Dakar as we speak?
Well, it seems Senegal was getting a hand around the pandemic at least 3 weeks ago. But with the resurgence of the virus, we've seen more and more cases over the past 3 weeks. I should say just before Christmas, we were somewhere around 17,000 cases. But over the past 3 weeks, we have had more than 4,000 cases. And today, the case count of COVID-19 in Senegal is 21,245 cases, 18,218 of those recovered, and we've had so far 465 deaths. Now, you know that we had the holiday, and during the holiday, many people were traveling in and out. So that might have also facilitated the further spread, the rapid spread of the disease. And on top of that, people were already letting down their guard, despite being told and advised by health workers to continuously use face masks, observe social distancing when appearing in public spaces. These rules were no longer observed. Drivers were cramping people up in their vehicles. So a host of factors really can explain the progression of cases that we are having in the country. And I should also let you know that this is winter in Senegal. And as you may have been hearing health officials, it is also a moment that enabled the rapid spread of the disease because people are spending more time indoors than the date when we had summer. So these are some of the factors that really explain why cases are increasing in Senegal. And that has also led to the government reimposing some of the measures that it had earlier imposed at the beginning of this outbreak. So over the past 3 months or so, the government had relaxed nighttime curfew. It had lifted the ban on inter-regional travel. It had also allowed restaurants to open and schools to reopen. And also sporting grounds and events were allowed to go ahead. But with the resurgence of the virus, it has been compelled to reinstate some of those measures. But again, it came as a surprise to some people, although not completely surprising. And this is what really led to the protests across the capital, Dakar. And let me be quick to point out that right now, what the government is doing is that it is imposing targeted restrictions because they have mastery of where the cases are emanating, the regions that have more cases. So these regulations are imposed based on the region that is recording more cases. So currently, the reinstated measures, for example, nighttime curfew, targets the capital, Dakar, and a nearby region called Chess. The rest of the country do not have a nighttime curfew. But then we saw people protest last week when the government imposed the measure. People are still counting their losses. People are just trying now to put back together the broken pieces. Businesses had closed. People had lost their jobs. And people were feeling much more relief now that there was a law in cases. But then surprisingly, we saw cases shooting up and the government had been compelled to reinstate. So people protested on grounds that they were not given sufficient time by the government to prepare. They were not alerted that there was going to be curfew reinstated, movement will be sort of restricted, and that's why people protested.
Interesting. I want to quickly talk about how the government and celebrities in Senegal were able to make it to the #2 position across the world in terms of having a handle on how to deal with COVID-19. I heard that artists, musicians, put out a PSA, drawing people in your local dialect to educate people as to how dangerous this virus is and why people should be protected against it. How widespread was that?
Well, Senegal is still a kind of, if I should put it this way, a kind of a traditional society. People still communicate more in the local languages than they would do in French. Even educated people, whenever they are gathering together, they speak the local languages, and the local languages do feature prominently on national television stations. So, in fact, they do present the news in French. If the news in French is 30 minutes, equal time will be dedicated to the main local language that is spoken across the country, which is Wolof. So they do massive sensitization in the local languages, using different means. I mean, making use of the expertise of artists, because these people are widely followed across the country. Their songs are widely listened to across the country. And so once the outbreak started, the government started looking for means to communicate to the public, started looking for influencers, if you may. And then they realized that the musicians were very much important, and they could be used as an important vehicle to drive home the message about prevention, the message about people exercising caution when moving out in public spaces, how they could work together to participate and help the government to get a hand around this outbreak. And so there was massive sensitization. You could see graffitis all around buildings in the capital, telling people to use a nose mask, telling people to observe social distancing, telling people to regularly wash their hands. So everyone got involved. But there is this tendency about people being shocked and afraid at the onset of a particular event. And with time, with the progression of time, people tend to forget, they tend to let down their guard. And this is also partly because of the misinformation, if you like, disinformation on social media. Some people wake up to the news in the morning that the pandemic is not affecting Africans as it is affecting people in other regions of the world. And to change people's perception about it, some of these things can become very difficult. And that's where the crisis is, deeply in the regions. People might not be as cautious as those who are in the capital cities. So it's an ongoing effort. And this is what really brought us here, because some people do not believe, or even if they do not regularly observe the measures that have been detected by the health officials, it makes it a bit complicated. But again, with the reinstallation of some of these very harsh measures, I guess everybody will go back to live the same way we did when this outbreak was first announced in the country. Hard times actually for the country, and especially for poor people.
Well, on the 8th of January this year, there was a passionate appeal, for people to wear their nose mask. He made news, Why do you think that people, because I mean, you mentioned at the beginning that people just, at some point felt that, they could throw caution to the wind. Why do you think that people felt so at ease to, a point where they felt like COVID no longer existed? What do you think was responsible for that misinformation, which led to this passionate appeal for people to wear their nose mask in a state, or rather in a country that once was named as the number 2 leading country in, handling COVID-19?
Now, again, I would just restate, there came a time that this country was recording as low as 10, 15, 8, 7 cases per day around October and November. That was when people started feeling complacent. That was when people started letting down their guard that COVID was almost about to be eradicated in Senegal. On the contrary, the government had opened the nation's borders. People were coming in by land, people were flying in. And some of these people who were coming in with the virus. And once people felt complacent that the country was not recording many cases like it did before, they felt that the risk was minimal. And because of this perception of minimal risks, people really did not feel it as being, they didn't see these measures as being obligatory now. And they didn't see the situation as life-threatening or with so much urgency to live and act according to the dictates of health officials in the country. So these are the factors that have really led to this country seeing a resurgence of COVID. But I should also hasten to say that Senegal is recording more and more cases because it is also increasing the number of tests that it is conducting daily. So we see that this country is sometimes conducting more than 2,000 tests a day. So that is why the results are coming out and we see more positive results. Unlike countries where they are not conducting mass testing of people, you really do not know how many people in the population are infected.
Let's talk about, I understand that the country has been struggling with a lot of, crises, especially when it comes to food and resources in general to be able to deal with, COVID-19. Paint us a picture, because I see that there was a time where the country had to.
Okay, so at the onset of the outbreak, the government infused or announced at least the infusion of so much money, at least $100 million. And it also waived some taxes for businesses. I remember at the time it provided food for the most vulnerable households across the country. And for a period, it provided free electricity to people who were already subscribing to the national electricity grid. And it also waived water. It gave out free water. And before this outbreak, people were paying for this. So the government made a lot of investment to the point of also allocating some money for the musicians, because these are people who have also been terribly affected by this outbreak, because they were hosting events, they were playing here and there, people were attending, people paying money to them. And they've been very much instrumental in driving home the messages to tackle COVID-19. And so the government has made significant investment in helping businesses pick up hotels. It had given out money to actors in different sectors of the economy. But again, you should also know that this is not a day's event. It is an event that is progressing. And with time, even if the government allocated millions of dollars, it might not be sufficient, especially for businesses that are really going to collapse, you know? And so these are the issues. The money that they provided, the rights that they provided for people might no longer be with them. So this is why people are agitating. First and foremost, they don't want the government to reinstate, because in some instances, the assistance that the government provided was not just enough for some people. So people are saying that we can take some measures, but we can't take those extreme measures that will lead to the collapse of businesses.
Let me ask you another very interesting question, because all over the world, there are people who've been affected most by this pandemic, and these are people who are homeless, the people who are rough sleepers. How was Senegal able to deal with these people, and how were they able to cover them in terms of, because there's a lockdown or there's a curfew of sorts that has been put out by the president. How are these people incorporated into the whole COVID-19 plan? Because, I see street children everywhere, and I don't think Senegal is left out of this.
So you have the street kids, which you've just indicated, called them here the Taliban. So these kids really come from Quranic schools, or they are supervised and looked after by Quranic schools. So at the onset of the outbreak, the government had advocated and pleaded with the managers of these facilities where they provide this Islamic education for the kids to keep them off the streets. And for a time, these kids were really kept off the street, because when the government made provision to distribute rice to the most vulnerable in the society, some of these centers were prioritized. So for a time, we didn't see the kids begging out. But again, like I said, like 2 or 3 months ago, when we started seeing low in cases, everyone was back on the streets. And so the kids are back. They are still going around daily begging, and not just the kids, poor people everywhere begging around in the streets. But again, there's a nighttime curfew, no matter what. By the time it's 7:30, people are rushing to go home. There's traffic, but the curfew starts at 9:30 p.m. So everyone tries to be close to home before 9:30 p.m. to avoid being caught up in this, because there's a punishment that you could pay. There's a price. The first night, those who ignore the nighttime curfew were arrested. Some were beaten by the security forces, which is what happened also from the onset of this outbreak. So the government is trying to target key institutions that look after some of the most vulnerable people in the society, and where necessary, they have gone out in the communities and provided bags of rice to community leaders to distribute among residents. So that's how far the government has intervened. But it doesn't mean, it doesn't seem that despite the assistance that they have provided, just seem quite sufficient for everyone across the country.
Mm-hmm. Okay. At some point, President Macky Sall had to quarantine because of COVID-19. In terms of sending a tough message to the people, especially because we know that there are people all over the world who do not actually believe that COVID-19 exists. And so they, like you said, to borrow your word again, they throw caution to the wind and say, oh, this is just another government propaganda. Was this infection, or rather this quarantining by the president, did it send some sort of a message to these sorts of people? Because sometimes they need to see someone big or maybe a member of their family suffer from COVID for them to believe. But did the president's quarantining send any message at all to the people of Senegal?
Well, it did, but Mary-Ann, I would tell you, I've really lived and worked on 2 serious pandemics. In 2014, at the time when I was in Liberia and worked for Médecins Sans Frontières, we worked exclusively on Ebola. At the time, many people in this country, in Liberia, did not believe that Ebola existed. And they only realized and accepted the fact that there was an Ebola outbreak when they started seeing health workers transporting dead bodies in trucks. This was when people were dying in their hundreds per day. At that point in time, people did not only react, they were stigmatizing health workers who were responding to the outbreak. So I think it's a wider African mentality that if it doesn't affect me, it is not true. Or if it doesn't affect me, it doesn't exist. You know, it comes to a point when people are affected before they take seriously what's obtaining or what they've been told that is obtaining. So currently the government is like daily, they give out daily updates about the progression of the disease. And initially people were hearing about one death, two deaths, three deaths. But yesterday we had 13. And they say this in the local languages. And I guess the message is going across. Over the past couple of days, since the government announced the reinstallation of some of the restrictions, we've seen people everywhere on the streets wearing face masks. We've seen people, I mean, in the buses wearing face masks. So it's not just a situation that people take lightly. Even if they would, there is this mechanism to enforce. So no one wants to walk on the street and be arrested by a police officer simply for not wearing a face mask. So people are sort of obliged to do it because these are very dangerous times, if you may, because the disease is rapidly progressing. We were somewhere at 16,000 cases in just 3 weeks, but today we have more than 21,000 cases. So by tomorrow, who knows how many more cases we're going to have in the country. So at this point in time, it's become sort of obligatory again because the government is reinstating and re-emphasizing that we are not off the hook. We're still in the loop because this virus is still here.
I'm so sorry to talk over you. I want to quickly ask this last question before we wrap up. Do you see the second wave becoming a challenge of sorts because of the content of the videos I saw coming out of Senegal as they were protesting? Because I mean, I listened to some of the comments of some of the protesters, and they were arguing why the president was allowed to take that decision solely, why he did not go through the National Assembly. But the most predominant thing in that video was that none of them was wearing a mask. Absolutely none of them. And they were protesting in their numbers. Does this cause you to worry that the second wave might be more problematic than what you had before now? Sincerely.
Certainly, we are all worried about what could happen because no one lives in isolation. We live in the communities and we commute together daily. We work together daily. So if one group of people are not taking the necessary measures that have been detected to contain the spread of this outbreak, then you might want to have a second thought about the fact that you are also exposed because your neighbor is not doing what he has been told to do, because if he doesn't, likely he could be infected, and any interaction that could expose you to that virus, you also could have it. So we are all afraid. Of course, they had protested, and today there was a debate in Parliament because the president and his government had asked or submitted a bill to repeal an act that says before the president can declare a state of emergency, he has to seek the approval of the national legislature. And this is partly why we had the protest from the beginning of this outbreak, because the president did not consult with members of parliament in keeping with law. He had gone ahead unilaterally to announce this state of emergency. And he has followed that up closely by submitting an act seeking to repeal the existing law that mandates him to consult with the National Assembly so that he has the sole authority to declare a state of emergency whenever he wishes or whenever he likes, based on the situation. And that will be tested in Parliament today. And if he does get the endorsement, the existing law will be repealed, and he will now have the leverage to declare a state of emergency in a situation such as what the country is experiencing right now.
Mawolo, I think that what we're left with now is just to hope that if people must protest, if people must register their, anger with what's happening in Senegal, they have to do that in a very protected way and hope that the presidency gets the message. But I want to thank you, Adolphus, for speaking with us on the show this evening. Thank you so much. We appreciate it. Hopefully you keep us posted with all of the developments coming from Senegal.
Thank you again for the invitation. I'm really glad to have made an appearance on your platform to be able to share the experiences that we have here with the people in Nigeria on your platform and everywhere in the world. Never hesitate to consult or to have me reappear to talk about the situation here. I'm always glad to make myself available for this.
Thank you so much. Adolphus Mawolo is the news editor for the English part of West Africa Democratic Radio. Thank you so much for speaking. He was speaking with us from Dakar, Senegal. Thank you so much, Adolphus. I appreciate it. All right. Well, I want to thank everybody for being part of this conversation. We were talking about COVID-19 in Senegal and how the government of Senegal has been handling the situation. Well, we will keep you posted with other stories coming from across Africa. And of course, on the show, you have the right to ask questions, share your comments. But this is time for us to wrap up the show. I'll see you sometime within the week. I'm Mariana Kum, broadcasting live from Lagos, Nigeria, the economic capital. Have a great day.